medicines to improve well-being, and it continues to play a central role in healthcare. It draws on the continent's rich and unique biodiversity of aromatic and medicinal plants. It is also a promising industry that African countries can do more to export internationally. Every year on the 31st of August, we do celebrate African Traditional Medicine Day, and to speak to us about this and more, we have Mr Abiaz Rwamwiri, the spokesperson of the National Drug Authority. First of all, a very good afternoon, sir. Thank you for joining us.
Thank you so much, and thanks for hosting me.
Indeed. Why do we celebrate this day?
Thank you. According to World Health Organization, over 80% of the population in developing countries use herbal medicines. And locally here, statistics show that over 60% of Ugandans use herbal medicine. And that shows how much people are into herbal medicine. And traditionally we've used herbal medicine by our forefathers to alleviate several ailments, and because of that, as African countries, we felt it was important that we put aside this day to celebrate, but also to come together and discuss the importance of preserving and advancing this field.
Indeed, Mr. Abiaz. But then in the midst of this COVID-19 pandemic that is wreaking havoc, what efforts have you put in place to promote traditional medicine in our national health systems?
As National Drug Authority, we take that importance of herbal medicine. I need to tell you that over 75% of our drug needs come from abroad, and as National Drug Authority, that concerns us. We need to create drug security. We've been working with herbalists and innovators to develop the herbal industry. On record, over 192 herbal products have been notified, are on the market, and we work with herbalists to improve the product from the garden to the final product, ensuring that there is quality. The quality of the product, meets the set standards, but also that they are safe. We have a state-of-art laboratory where we test to make sure that even when we promote and we want these products on the market, they should be of good quality as a way of safeguarding the public health.
Indeed. So if you are now the people charged with the promotion of traditional medicine in the country, so why were you the same people trying to fight Professor Zhang when he was trying to push COVID-19, Mr. Abiaz?
We were not fighting anyone. We do not fight anyone. We want to ensure that before your product goes onto the market, as National Drug Authority, as regulators, we've worked into it to ensure that it is safe. And indeed, after working with him, we notified that product. Remember, the claims that were there, we had to work because we want to make sure that Ugandans get a product that does not mislead them. Even when these products are on the market, before they can go through clinical trials, they cannot. We don't want them to be pushed, as a cure. So when you have curative claims, we'll definitely have to sit with you and work with you through the processes.
So that was due process that we saw at first. Mr. Abiaz Rwamwiri, thank you very much for having made the time to speak to us.
Thank you.
And of course, you're still watching NTV at 1. A break is in the offing, but we return shortly with